Did you know that autism is commoner among male children than among female children? And that autism is more common in children of the rich and wealthy? Well, now you know. Autism is a developmental disorder that occurs in children, peculiarly before 2 years of age. In this video, I'll be talking about features common to autistic children. With that being said, let's jump right into the video. Ritualistic and compulsive behaviors. So an autistic child will always have one behavior that is consistent to him or her. So take for example the Good Doctor. In the Good Doctor series, this doctor who is autistic, once in a while, consistently taps himself on the head. That's his ritual, that's his compulsive behavior. If a child has this trait, there's a particular condition, there's a particular behavior he repeats over and over compulsively, then this is most likely a pointer to autism. Attachment to inanimate objects. So I'll still refer back to the Good Doctor series. So there's a particular knife, scalpel. They call it a scalpel, but it's a knife, but medically called a scalpel. There's that particular scalpel that he is addicted to, is attached to. Remember I said this doctor is autistic, so that is him showing the classical sign of autism. So if your child is addicted to an inanimate object, this could be a sign that he or she has autism. Absent separation anxiety. So a child is normally expected to cry and be all anxious whenever he's separated from his father or mother, from the caregiver. But an autistic child doesn't react, doesn't get anxious, doesn't cry when separated from his or her guardian. Absent social smile. At about the age of 2 to 3 months, a child is expected to smile when a stranger smiles or plays with him or her. That child is expected to smile. But if at that age a child doesn't smile, this child is most likely autistic, unaware of other people's existence or feelings. An autistic child cares less about people. He doesn't care about people's feelings, doesn't care about people's emotions. So take for example a child's mother is crying. If that child is autistic, there will be no sense of sadness for that mother, for his mother or her mother, unlike a child who is not autistic, who would automatically be sad because his mother or her mother is crying. There's a saying in psychiatry which calls this lack of emotions for people treating people like furniture. Mental retardation, otherwise called learning disability. Remember in my previous video I talked about autistic children having mental retardation. So if you notice that your child is always below in class despite every tutoring, learning, studying hard, and there's a problem with learning, then this could be a sign that your child is autistic. Children differ. So all these things I've listed might not certainly mean that your child has autism, because as I just said, people differ, so children differ. But the thing is, the advice I will give is, if you notice that your child has more than 2 of these signs, more than 2 of these features, then you should present at the hospital so that a medical personnel, a pediatrician, a pediatric psychiatrist can attend to your child and profile early diagnosis so that your child will not experience complications associated with autism.
Hello fam, welcome to the Psychic Gym. My name is Tofumi and I'm a medical student and psychiatrist in VIEW. On this channel, I talk about topics related to mental health and also topics that relate to a positive mindset. If you've enjoyed this video that you just finished watching, make sure to like and subscribe so that you can get notified when I post new videos, and also so that my videos can reach out to more people so that they can learn and know better about their mental health. Yeah, so welcome aboard. Stay cool, stay fresh, and most importantly, stay psyched. Cheers!